and a very clear targeting of healthcare facilities and healthcare workers, and deliberately destroying the infrastructure of all the hospitals to make it almost impossible to provide anything resembling normal healthcare to the population of Gaza. The only way to prevent that ongoing humanitarian catastrophe is an immediate and permanent ceasefire. And I guess I'd like to just finish by describing an experience I had in Gaza only a few months before October the 7th, when I was there in May of last year. And I'd gone out there to carry out a week of cancer surgery, and on the second night I was there was a sustained bombardment. And you may remember it was the last big bombardment before October the 7th, and Gaza was locked down, the borders were closed, we weren't allowed to leave the hotel until we were eventually evacuated by the UN. But I witnessed during those 4 days non-stop bombing from the Israeli Defense Force and non-stop rockets going over from Islamic Jihad into Israel. And we saw firsthand the incredibly targeted, sophisticated targeting the Israeli Defense Force were capable of in taking out and killing the Islamic Jihad leaders by targeting single rooms, single floors of buildings with very little collateral damage. So we know they can do that, and their claim that they are targeting Hamas militants now, in the light of what I saw then, has no credibility at all. Thank you very much.
Good afternoon one more time, and I would like to focus my words on the people behind the numbers. Sometimes and I'm sure that you are receiving all kind of reports about the number of children who were killed, 13,000 or so or more, which means 1 out of 100 children in Gaza has been killed, and this is an astronomical number. The equivalent of that in the United States would be 500,000 children being killed. So I think we sometimes look at these numbers in absolute. We do not put them in the context. 70,000 people who were injured, half of them have moderate to severe injuries. That means they will have some type of disability for the rest of their lives. 4% of the population either killed or injured. 85% of the people are displaced. So the purpose of our meetings today with member states, and tomorrow and day after, and Friday with the administration, is to instill sense of urgency about the situation, because I think Gaza is reaching a tipping point. Gaza is reaching a tipping point where the shortage of food and water and fuel and medicine and medical supplies, and also the collapse of the healthcare system, is causing accelerated death among people who are innocent, and also people who are injured and having surgeries, having more complications. And that is leading to what we are right now witnessing in terms of the famine, increasing rate of malnutrition, food insecurity that is rising, catastrophic in half of the population, and more death related to non-communicable diseases because of the shortage of medicine and dialysis and chemotherapy for cancer patients. So these numbers will continue to accelerate even if the war stopped right now. And if there's continuation of the status quo or acceleration with the Rafah offensive, then you will have more injuries and death among the population. Gaza is at this stage unlivable because of the consistent destruction of the infrastructure that are required for life. So I want to focus on the people. This is Hiyam Abu Khadr. She's 7 years old. She is one of the victims of the war in Gaza. A bomb hit her family home, so her father and brother were killed, and her mother also was injured, and she had burned, and she sustained third-degree burns on 40% of her body. She was treated by one of our volunteers, Dr. Vanita Gupta, who is critical care specialist from New York, in the European hospital in Deir al-Balah. and Dr. Gupta took some videos of her, and you can see her face in the videos, and also in this picture. And if you want to define post-traumatic stress disorder, this is what post-traumatic stress disorder look like in the face of a child who's 7 years old. She was supposed to be evacuated to Egypt, and she waited for weeks before she was eventually evacuated, and she died 2 days after evacuation because it was too late. 8,000 patients are supposed to be evacuated from Gaza to neighboring states who wanted to treat them, but for some reason they are delayed. Only 10% of them have been evacuated so far. This is Muhammad Khalil Abu Shahli. He's 12 years old. He was displaced with his family from eastern Khan Yunis to area around Nasser Hospital because thousands of people believe that hospitals are safe. It turned out that hospitals are not safe in Gaza. We've seen that in Syria, we've seen that in Ukraine and other places, but in Gaza it's worse because the population are concentrated in very small area that is shrinking, keeps shrinking. That means everyone is close to the fighting and the bombs and the missiles, and that's why we have this high number of injuries and death among civilians, especially women and children. Muhammad Khalil Abu Shahla was brought to Nasser Hospital after a missile hit a distribution center. There were 32 injured people who were brought all together to the emergency room. 7 of them were dead on arrival. There was complete chaos in the emergency room. Most patients were treated in the floor of the emergency room. Dr. Thair Ahmed put a breathing tube in the mouth of Muhammad because he was not breathing, and put him on life support. And then he had surgery for shrapnels in the abdomen. And then he went to the intensive care unit. I took care of him in the intensive care unit next day. He never woke up. He was pronounced dead, and we were not able to communicate with his family, and we sent him to the morgue. And I made a copy of his death certificate because I want to take a proof. Sometimes the media ask me before the Gaza crisis, do you believe the numbers of death? I believe the numbers of death. This is one of them. I think this is an underestimate of the real numbers of death. Today there was a report about the 5,000 or so people who disappeared in Gaza. Most of them are still under the rubble. But this is one story of the 13,000 children who were killed in Gaza.
Thank you, everyone. If I can just mention about our time at Nasser Hospital. Yes. Oh, I'm Dr. Thair Ahmed. I'm an emergency medicine physician and a board member for Med Global. I was in the Gaza Strip in January as a part of the WHO's emergency medical team, as a part of Med Global's delegation. And so we were at Nasser Hospital. Nasser Hospital was the second largest hospital in the Gaza Strip, and during the time of the war, it was the largest hospital while we were serving there. We were seeing hundreds of trauma patients because Khan Yunis was the center of a military operation, and we were also seeing many thousands of displaced people sheltering in and around the hospital. While we were receiving the trauma patients, in the background you would see children in the hospital, families sheltering with mattresses. And as my colleagues have mentioned, one of the concerns that we all have and the urgency of all of this is that the healthcare system has essentially collapsed, and that the hospitals that used to exist prior to October 7th are no longer standing and no longer functional. Shifa Hospital, which has been in the news as of 2 days ago, is the largest hospital in Gaza. And with respect to what happened at Nasser, in the subsequent weeks while we were there, we saw that it was ultimately under siege and then raided, with 70 of its healthcare workers arrested and rendered inoperable, with many of the people having to go further south to Rafah, where already 1.4 million people existed prior to what happened in Khan Yunis. Many of the healthcare workers there decided to stay. I was one of the people that decided to evacuate prior to the raid and the siege. And I think it's important to share some of their stories, to share what they're going through, because they're incredibly heroic people who are deciding to prioritize the health of their patients despite having a legitimate threat against their safety, their security, and their life. And one person in particular was an ICU doctor that had his arm broken while he was on his way to the hospital. He had been unable to care for his patients, and he's somebody that is a part of the problem with the healthcare system collapsing. The second part of this that I want to mention, in addition to hospitals having to be subject to attacks and having to not be able to operate and having their staff arrested or killed, 400 of whom have already been killed during this war, is us not being able to provide them with the support that they need and the equipment that they need and the supplies that they need. On our way entering into Gaza, we saw hundreds of trucks stalled at the border on the Egyptian side. We know that these trucks have baby formula. We know that they have many items. And I just wanted to show what some of those items may look like. Diapers, inhalers for those with asthma, and this small vial of medicine here is a medicine that we use for sedation, midazolam, Versed. This is something that we could be using for our patients who are there, who are in pain, who are we're trying to reset their fractures, we're trying to clean their burns. It's an incredibly painful process, and this is something that can help. Something this small, we're not able to get into the Gaza Strip because the trucks are stalled. Or if someone is having difficulty breathing, as you may suspect may happen as bombs are dropping and the air fills with smoke, not able to get a rescue inhaler in to be able to treat their asthma. Or diapers for family members. We've heard of people having to use plastic bags because they cannot find diapers, and if they do find them, the price of them is incredibly high because of inflation and the lack of supplies entering. And so I hope that this is something that can bring home what we're talking about and the urgency that exists on the ground. We need our hospitals to be able to stand. We need the bombs to stop dropping, hopefully through a ceasefire. And we hope that we can get the necessary aid that's in to help alleviate the incredible amount of suffering that's taking place in the Gaza Strip. Thank you.
Hello, my name is Amber Alion. I'm a pediatrician, and I'm the medical program manager for Palestine, Afghanistan, and Haiti with Doctors Without Borders. What I'd like to talk about, after having heard what my colleagues have seen and what we've all seen, including with the teams with MSF, is how exactly is the health system collapsing and where do we go from here? MSF has been working in the Gaza Strip for about 15 years. We've been doing either orthopedic surgery, trauma surgery, burn surgery, or mental health, or a combination of all three. Since the start of the war, we started working in Shifa. We've been working in Nasser. We have a hospital in Rafah that does post-operative care, inpatient and outpatient care. We have a team working on post-delivery care for pregnant women, screenings for malnutrition, primary care, working with with chronic diseases. And what we have seen is a complete devastation of the healthcare system. And when Thaer talks about not being able to get midazolam or diapers or inhalers in, it's absolutely true. But there's another component, which is when the medicines do get in, how do they get to the right place and how do they serve the people in need? There is a huge focus, for example, on surgical care, which is absolutely necessary. But when you have a child who's having a seizure and needs to be treated, there's not enough medicine to go for the person who needs to be sedated, to be intubated, or the child who's having a seizure. And doctors are being forced to make choices in those cases. We have a system where the hospitals rely on quota systems for how many drugs they keep in their pharmacies and their stocks in each department, and they have to choose between whether do I fully stock my operating theater, my ICU, or my emergency room. And this is where you have doctors faced with horrific decisions of having to intubate and amputate children and adults without anesthetics in emergency rooms. Part of the reason for this is the lack of medications or the lack of medications accessible at that time. Part of the reason is that we have internally displaced people living in hospitals, sheltering in hospitals because they have nowhere safe to go. And what that means is they are staying in hospital beds. So what does that mean for injured people? They arrive, they get a quick and dirty surgery in an emergency room or in an operating theater, and they have nowhere to be hospitalized afterward. Or when they are lost all throughout the hospital, and our teams spend all day searching for the patient that they just operated on 12 hours before. What does this mean over the long run? The longer this war goes on, the the longer these wounds have to rot, and I mean really rot, the infections are getting worse and worse, and it's horrific. It's horrific for our providers, and it's absolutely horrific for these patients. We have seen patients who've traveled, who were victims of explosive injuries, a family of 11, for example, a whole family that arrived to our hospital in the south from the north. They've been moving for 3 months looking for hospital care. They were victims of explosions. 11 members of the family were burned. The woman that we received had her 2 children with her. She had 3. The 1-year-old died on the way due to sepsis. This is what's going, and this is one out of many thousands of stories. The hospitals can't cope with the burden. No hospital in the world, high income, low income, could cope with the amount of injuries that we're seeing and the needs that we're seeing on the ground. When we talk about helping this population, which is a very resilient population, and a hospital may be rendered dysfunctional one day, and a week later you have the entire staff showing up saying, okay, let's clean it up, let's start over again. But when we talk about helping this population, we talk about we need access. Our doctors need access. Our nurses need access. They need to not be targeted. We've had ambulances targeted. We've had convoys of medical personnel targeted. We've had hospitals targeted, clinics targeted. The shelters where staff have been targeted. In order to be able to ascertain whether there is malnutrition, for example, across the Gaza Strip, you need to be able to do surveys among the population, which means you need to be able to access and touch the population. What we have been able to do is extrapolate from the few patients, the relatively few patients that we've seen in our clinics, the numbers of malnutrition that we're seeing. But what we know is that we can access a whole host of children and pregnant and lactating women who are the most vulnerable in the north. And we know that they don't have access to food, or what food they have is exorbitantly expensive. To be able to access this population, we need access that's safe for the medical providers, as I said. 2 populations are particularly vulnerable. Pregnant and lactating women who were already facing iron deficiency anemia before the war, which puts them at risk for hemorrhage during birth. With the war, it puts them in a state of undernourishment or malnutrition, potentially malnutrition, which means that they can't breastfeed their children properly. The milk doesn't necessarily come in, and it's definitely not enough. And the other population is children under 2 years, which is the breastfeeding age. There's not enough space for us to work closely with the mothers to help them start lactating again. We can't even access them. And to be able to do that, you have to have day-to-day activities with those women, and that is not something that's possible for us right now. Those children need to be breastfed. If they can't be breastfed, they need formula. To have formula, you need clean water. None of these things are possible. What we're talking about is women who are squeezing fruits, dates into handkerchiefs, into tissues, and drip feeding their children with some sort of sugary substance to nourish them. The consequences of this over the long run mean that there is a lack of bond between the mother and the child. It means that there are physical and psychological delays for these children to develop. And in the future, for those children who do grow up, it means that they are more at risk of having high blood pressure, of having diabetes, and other complications. When my colleagues talk about the injured patients, as I mentioned at the beginning, these wounds that begin to rot, how many people are going to need prosthetics? What is the socioeconomic status of Gaza going to look like in 5 years, in 3 years, in 3 months? How can this population that is so incredibly resilient rebuild itself? And the longer the war goes on, the harder this becomes. It's not impossible, but it just becomes harder and harder and harder. And the sooner we act, the better.
Great. We will take questions. First to Anka Edith Lederer of Associated Press.
Thank you very much on behalf of the United Nations Correspondents Association for doing this briefing. We all appreciate your being here. Prime Minister Benjamin Netanyahu announced today that Israel plans to go ahead with its offensive in Rafah. I wonder if you could address the health implications for that, being that there are 1.2 or 1.3 million people still displaced in Rafah.
Maybe I can start, and my colleagues, I'm sure, they will add to this. But this is probably the worst crisis that can happen within this war, if it happened, I hope and pray that it will not happen, and that the pressure from the international community will stop this offensive, because the 1.3 or 1.5 million people in Rafah have no other place to go. So there's 2 hospitals in Rafah. There are thousands of tents. The first thing that when you enter Rafah, you will see thousands of tents everywhere, where you have 10 to 20 people cramped in every tent. And you have also these schools, UNRWA schools, that were converted to shelters. So in every class, you have 40 to 50 people. In the south and the east, you have the border with Egypt that is very difficult to get through, impossible to get through. Then you have the Mediterranean in the west, and then you have Khan Yunis in the north, which is also a theater of fighting and bombs and missiles. So there's no place for this population to leave. That means if there's any offensive, then you're going to have a bloodbath. You're going to have massacres after massacres, besides, of course, the deterioration of the health center related to the collapse of the healthcare system. Pregnant women will die because of bleeding. Neonatal will die because of lack of care. Patients who have diarrhea will die of dehydration, and many other things that related to the absence of access to health care. So there were some estimates that 250,000 people will die in case that there is escalation of the current war, escalation of the status quo. 250,000 people die directly and indirectly in case that there is escalation or Rafah offensive. And that's a biblical number, and we hope that it will not happen.
I'll just add a couple of things to that. In Rafah, there's a single governmental hospital, which is Al Najah Hospital, which has got 60 beds. There's a small private hospital called Kuwaiti Hospital with 20 beds, and I think the MSF hospital is 100? 80. So that's for a population of well over 1 million now. And if there's a ground invasion of Rafah, it'll be apocalyptic, really, the number of deaths that we're going to see. And of course, as we're seeing, they'll be told to evacuate and move somewhere safe, and there is, as we've heard, there is nowhere safe for them to go. There's no intensive care beds in Rafah. There's, I think, 6 operating theatres for that population. So the healthcare system cannot cope with the work now. It'll be inestimably worse if there is an invasion of Rafah.
Ibtisam?
Hi, my name is Ibtisam Azim, an Arabic newspaper. I have two questions. The first one about the mental health issue, and that people are like doctors, nurses, the medical staff is facing. Is there any services that any of you, the people that COVID in, could support them? Could you say more into that? And also in your tours and in your meetings with politicians and decision makers, which reactions are you hearing, whether in the U.S. or other Western countries? Are they understanding how difficult it is, or the gravity of the situation? And why do you think there's not much need to put more pressure on Israel to stop the war and to have a ceasefire? Thank you.
I can speak to your first question and then leave the next to one of my colleagues. In terms of mental health, the teams that are on the ground, especially the many actors that have been working in Gaza for many, many years, we have teams that are trying to provide mental health services. It's very difficult, though, because many of those teams are themselves victims of trauma, and that makes this an ongoing battle for us. Our doctors, our nurses, our healthcare workers, the cleaners, anyone who works in the healthcare system, they are completely exhausted. And on top of that, they have to worry about the safety and security of their own families. They're dealing with the losses of their own homes. And they have all of this going on in their minds while they're trying to carry out very heroic acts with their patients. So they are. There are some that have definitely displayed signs of acute stress. There are, and who we try, I know for our teams, and I'm sure the other teams, where you try to give them breaks. Part of it is that they want to keep working because that serves somehow as a therapeutic methodology for them. There are others who simply can't work, and we have to be obviously very patient with that and accepting of that, because it's absolutely understandable. For the patients, they are completely traumatized. We have many patients that come for primary care consultations just to be able to talk, just to be able to get some kind of TLC, some sort of care and compassion. The mental health needs are astronomical and will be going on for many years. Among our staff, we have two things that concern them. It's my children today and my home tomorrow. And this is something that preoccupies them. And what we've seen in the past is that people who will come for mental health consultations, they come for their children and they stay for themselves. And right now we're seeing people are coming for their children and for themselves. It's just that dire.
You know, there's a phrase in Gaza that I heard while I was there that people kept repeating, and I think it underscores this the mental health needs. But many people would say there's a war after the war. There's a war after the war, and it's a day of reckoning for the people to think about everything that they've lost, all of the struggles that they've been through. And that's why I find it really cruel and unusual to talk about a Rafah offensive. People have been displaced multiple times. And so this is something that I think many NGOs are thinking about and are concerned about. I will mention that the first mental health delegation will be entering the Gaza Strip in April. So foreign mental health professionals are going to try to support the mental health professionals that are on the ground in April. And as far as your second question goes, I think we've found that many of the delegations that we've met here are aware of the humanitarian catastrophe that's taken place. We are trying to support that with our eyewitness testimony. We're trying to drive the point home, but we also are trying to communicate the urgency. Oftentimes what we can see is there can be a paralysis by analysis, and there can be a lot of deliberations that take place. We just want to press upon the people who are at the table that this is very urgent, and we need things to change within the next few hours or days, not weeks.
On mental health, MedGlobal provides mental health support incorporated in the medical points and the clinics that we have in Rafah. And we run about 10 medical points. Medical points means a clinic inside a shelter or an IDP camp. Okay. And it's run by local doctors and nurses. So in every one of them, we have someone who provides some kind of mental health support, usually mental health first aid to patients inside the camp or the shelter. And also, just last week, we sent a team that is focused on training the trainers on community leaders in the same camp, because you have a huge number of people who are traumatized. So no matter how many specialists you send, not going to be enough. So you need to train the teachers, the camp leaders on mental health. And they did that training, and the next step would be to provide them with medications, because there is no medications to treat depression and PTSD and anxiety. And as Dr. Thaer mentioned, what's happening right now, and we've seen that in Syria and in Ukraine, that people are moving from place to place because of the war and the violence. They're focusing on survival and coping with everything that they have to survive. But after the war ends, you will see a lot of PTSD and depression and anxiety, and that's the time when there's such intervention. On your second question.
Sorry. Could I just one more note on the mental health, which is to say, as Dr. Zahar is saying, it's very difficult to do psychotherapy in an active war zone. So you really are only left with psychological first aid. All of our organizations are trying to integrate that mental health component into our work. We do have access to psychiatrists and drugs, but with the war ongoing, it's a drop in the bucket.
The reaction of the member states basically represents the policies of their countries. So we notice that there's very warm reception and reaction from Ireland, for example, from South Africa, from Slovenia, from Malta. But in general, I think everyone was receptive to the stories that we had. And I think it's important to put faces on the numbers and the reports that people are receiving.
My first question is about how do you evaluate the whole thing? Is it and give it a title other than genocide? And the second, how did the people in Gaza perceive the international community and the UN and the Secretary General and Secret Guard and all those UN officials who Some of them try to blame the victim, like Karim Khan and Pramila Patel, who put more blame on the Palestinians. Thank you.
I spent some time a while ago looking up the definition of genocide in a variety of dictionaries, and what is going on in Gaza fulfills every single definition of genocide that I have read. So there's no doubt in my mind that's what's going on, and I think the end game, it appears to those of us who've been on the ground there, and indeed, more importantly, is the views of all the Gazans I've spoken to, is that the end game of the Israeli government is to force them out completely from Gaza, to eradicate them from that land. So I don't think there's any doubt in my mind. And we've brought this up at government levels in the United Kingdom, and I think received fairly short shrift from them about using that term. But and of course this is subject to the international cases being brought by South Africa. But at the very, very least, whether you agree it's genocide or not, there is a very clear, strong argument that it needs to be questioned as to whether there's genocide. In response to your second question about what do they all feel, well, I think they welcome seeing some humanitarian aid workers go out there, but they largely feel abandoned by the rest of the world. And some of my colleagues in Oxford set up a platform called Gaza Medic Voices on Instagram and Twitter. If you haven't seen it, I'd urge you to have a look at it. And it provides a platform for healthcare workers in Gaza to describe their experiences, photographs, audio testimonies, written testimonies, all of which have been verified. So a lot of work's gone on to verify them all, and they're describing what they feel like. And I've read many, many of the quotes. I've received a lot of them myself from people, and the common theme is, why is this happening to us? Why has the West abandoned us? What have we done wrong? So they feel they've been abandoned by the rest of the world.
And they would take it, I would say, one step further too, and they're asking why are they not afforded the same sort of defense that maybe other people get? And they were concerned about why their values stop at the border of Gaza. Why do some of these values not extend to the people of Gaza? And they would ask, of the 13,000 now kids that have been killed, did they not have a right to live? And that's something that we would hear.
I think people in Gaza, and like many other people in the world, whether it's in the Arab world or the Muslim world or the global South and many Western countries, kind of see the hypocrisy in the way that the international community have dealt with this crisis compared to, for example, what happened in Ukraine or other places. And I think this, as American, undermine our national security and interest in the region, because we are losing the hearts and the minds. Mm-hmm. And our moral leadership in the world is undermined by what we are not doing in Gaza, understanding the limitation, but understanding the power of the U.S. and the administration, the fact that we can do things much better and much faster than what we are able to do right now.
They do distinguish between the population from these countries and their governments. They are incredibly astute in that sense, and I echo what the other panelists have said as well on the rest.
Go ahead. Sorry.
I work for Global TV, Brazilian network. My name is Carolina. I would like to ask you, obviously, compared to what you see there, what you feel is smaller, but how do you deal with your feelings and your traumas? And also, I understand you're going to DC tomorrow or the day after. Why? What exactly do you plan to do there?
I mean, the way we deal with our feeling is by having platforms like this, where we share what we have witnessed, the stories, the painful stories, and the suffering of the people, with people who can influence the situation. I think we need to make sure that the public knows what's happening. This is our duty. And it's also what we promised our colleagues in Gaza, that these stories and their aspirations and dreams will be conveyed to the highest level. So the meetings today and yesterday and the next 3 days are therapeutic to us. But it's not easy. These things stay with you for the rest of your life. our goal in the next 3 days is to get this message to the highest level, because we understand, I think everyone understands, that the only country that can influence the situation is the United States of America. So by talking to the National Security Council staff and members of the Congress and the State Department, we want to make sure that they know what we know, and hopefully that will affect the decision-making process.
I think that we've all heard sort of tragic. We have colleagues there. I've been going for 5 years to Gaza. I have very good friends, very good colleagues there, and I can't offer them words ever when they tell me the tragedies, when they tell me the stories, and what they want are actions. And so I think that's how we manage. We cope. We come here. We work. It's not enough for us to just say, "I'm so sorry this has happened to you." We can't. There are just no words. So our therapy is our action.
Actually, my question was very similar, is about how you process all of this, and if you could expand a little bit on that. Professor Maynard, you talked about how you were not prepared for what you saw in Gaza. Can you expand a little? What had been your experience previously, and why is it different today? And also, would you mind commenting briefly on Israeli claims that medical infrastructure, healthcare infrastructure in Gaza is being used as Hamas militant strongholds?
Yeah, I'd be very happy to address that. So I've spent nearly 15 years going to Gaza. As I said earlier, I've operated in their operating theatres, and I've worked in what are always very challenging situations, but it's become what I consider to be essentially normal for Gaza, but recognising their very challenging situations. And since October the 7th, almost daily, myself and my colleagues in Oxford, there's a big group of us who've been going out to Gaza regularly. We've been talking almost daily or messaging friends and colleagues on the ground in Gaza, particularly in Shifa Hospital during those first 6 or 7 weeks. And we heard and listened to and testimonies and saw pictures which were far, far worse than anything we were seeing in the press. So I really thought I knew what was going on. I was prepared for it. But as I said, I wasn't. And I saw things at Al-Aqsa Hospital which I still wake up at night thinking about. Appalling injuries in particularly women and children. The most devastating burns in small children. One child that I'll never forget had burns so bad you could see her facial bones. We knew there was no chance of her surviving that, but there was no morphine to give her. So not only was she inevitably going to die, but she would die in agony. And what made it even worse, that there was nowhere for her to go and die. So she was just left on the floor of the emergency department to die. And that's just one story. We've all seen multiple stories like that. So I hadn't been prepared for that. I could go on describing the most awful clinical cases, and I think we've got lots of stories like that. I'd be happy to address the second part of your question about the Israeli claims that these hospitals are used as Hamas command centres, and I can only really talk about my own experiences over many years. And I've spent many visits at Shifa Hospital and a lot of the other hospitals as well, and I've never, in any time during my visits there, seen any evidence of military activity of any Hamas militants in any of the hospitals. I know Shifa Hospital very well. I've been to every single square inch of Shifa Hospital. There is no restricted access at all. I have never seen any Hamas militants, and in the 2 weeks I was in Al-Aqsa Hospital, I would say exactly the same, that I saw no evidence of it at all. Now, I cannot, and none of us can really vouch for what's going on in any tunnels. We didn't see that, but I can certainly say that I saw no evidence of it at all in the hospitals. And as a final comment, during those 3-4 months following October the 7th, as I said, I've been in contact on an almost daily basis, as I think we all have, with our friends and colleagues there. And these are people I've known for 10 years. I consider them to be very close friends, some of them like family. And they have never seen any evidence of that, and I would trust them implicitly. So I think they have, and the Israelis have provided no credible evidence whatsoever to support those claims.
If I can just add, with respect, I wrote an op-ed in USA Today about the Palestinian healthcare workers, and I just want to give a nod to them because we had seen things that I don't think we'll see in the UK or the US with respect to the environment that we have to practice in. And speaking for myself, I felt very overwhelmed the first few days that I was at Nasser Hospital with the amount of injuries that we were seeing and how little resources we had. And if it was not for the Palestinian doctors and nurses holding my hand and showing me how to treat these patients, I think I would have been useless for the rest of my time there. So I do want to mention that. And then I also want to say, with respect to these hospitals, just remember who's inside of them that we know for sure are inside of them. And all of us saw the people that were inside. And we saw lots of families and lots of children who have not gone to school for over 5 months. And so it's really tough to deal with understanding what's actually taking place and who's sheltering in these hospitals.
To me, it brought also flashbacks from what we've witnessed in Syria, Syrian American, but it brought the same images that we've seen in Aleppo and Idlib and other cities where you have mostly children and people trying to pull them from under the rubbles with their bare hands because there is no machineries and there is no fuel. And then fathers and mothers carrying what's left of their children, their remains, and screaming to the world, and hospitals being attacked in Syria, more than 600 hospitals, and the same pictures of children who died in Madaya and Zabadani because of the siege, and now we're seeing similar pictures in northern Gaza with malnutrition children dying because of the blockade. So because I believe that there was no accountability to what happened in Syria and what's happening in Ukraine, there's similar scene that we are witnessing unfolding in Gaza.
Colin?
Yeah, Colin Lynch from Medics. Could you maybe just talk a little bit, there seems to be a bit of a split street from the enormity of the situation that you're all describing and the diplomacy around the response, and you're talking about the influence of the U.S. The U.S. is very much focused on this notion of airdrops, pressure on Israel to provide more access, and now the big focus is on this maritime corridor. And I'd be curious from your perspective, are these, these kind of efforts, are they really significant and meaningful? Is there a little kind of, kind of absurdity in this notion that the responses that are being considered don't seem to be significant enough to really address what you're talking about?
I think, all of us in the humanitarian world, agree that airdrops and maritime aid is not the most effective or efficient or cost-effective or better way in dealing with the famine and the shortage of everything. And that land border crossing, and there are 6 border crossings, land border crossing in Gaza, only one of them is used partially, which is Rafah border crossing. And Karam Salim border crossing, which was supposed to be open, is not activated. And there's no reason why not other border crossing and Karam Salim and Rafah work for the full capacity. Actually, last month, there's 50% drop of the number of trucks that are entering Gaza compared to the month before. So instead of going up, it's going down. I spoke with one of the leaders of Catholic Relief Services. He runs a warehouse in Gaza and in Rafah, and he told me that we need 1,000 trucks every day. Not the 500 pre-war, 1,000 trucks. So whatever is being done is dropped in the ocean, and I think it's a sign of impotence, not a sign of strength.
I'll add a bit to that. The certainly in the UK, the big focus from the government is on getting aid to Gaza, and there's been a lot of reporting of the airdrops, the maritime, and as I said, it's the land crossings are not being used appropriately. But the focus shouldn't really be on the amount of aid going to Gaza. It should be on the distribution of the aid within Gaza. Because however much aid you get to the Gaza, as long as there's ongoing military activity in Gaza, it's impossible for that aid to get to where it should be. I spent 2 weeks operating every single day in the operating theatres at Al-Aqsa. Some days we didn't have any surgical gloves, so we had to wash previous ones. Sometimes we had no surgical drapes. Many days we had no morphine. On many occasions, no antibiotics, so really limited resources, knowing that actually a lot of those resources were probably in depots somewhere or maybe in lorries queuing up outside Rafah, but could not be distributed. And this is what is so urgent about the need for a ceasefire, is that the only way that aid that's being delivered to Gaza, and we welcome every bit of aid, the only way that aid is going to get to where it's needed is if there is a ceasefire.
And you would think also that if we're able to achieve a ceasefire and we're talking about a maritime corridor, we're talking about airdrops, that we wouldn't also simultaneously be talking about defunding a UN agency that's on the ground that has a capacity to deliver the aid that we're talking about.
Jessica.
Hi, Jessica from France 24. I was wondering if you saw any injuries in any of your patients, and in particular in children, that might have been from drone attacks. I read that there were some signs of slightly different types of injuries from some drones.
I can certainly talk about the brother of a very close friend of mine who was shot. He is a nurse in the operating theatre, and he was shot in Nasser Hospital by a quadcopter, a drone with guns on it. And there are numerous stories. I think you may know more about Nasser. There are numerous stories of people being shot by drones with weapons.
Did it come into the hospital?
Yeah,
Outside the shop?
it came into the hospital.
When was that?
3 weeks ago. I can share the details.
Thank you. I have two questions, please. Dr. Thayer brought up UNRWA very quickly. Could you elaborate more on how these attacks on UNRWA are affecting things on the ground from your perspective? One, and two, do you feel, this is a bit of a follow-up on Abdel Hamid's question, the positions and appeals from the UN officials here, do you feel, Dr. Thayer, you also spoke about the importance of conveying the urgency of the situation. Do you feel the statements, the positions, the appeals that are coming out of the UN are at the level of what's going on there? And what do you expect from UN officials? What would you like to see them do better? I'm not talking about Security Council, I'm talking about the rest of the UN.
I'll quickly say two things. The first, with respect to UNRWA, I think everybody understands that the work that they're able to do cannot be replicated. It's not going to be replicated overnight, over a couple of months. We're talking about an organization that has over 13,000 employees, 165 shelters with over 1.1 million people in those shelters. They focus on health, food security issues. They focus on water and sanitation. They focus on education. This is not something that you can just defund overnight and expect that everything is going to be okay. So, I mean, UNRWA is a lifeline to the people of the Gaza Strip. All 2.2 million people interact with what UNRWA's service is. And so I think it's especially important for us to recognize the work that they're doing on the ground, but also realize you have a very valuable partner that can reach the vulnerable communities, that's from the community and knows where to go and where the aid should go. I think that's very important. And then very quickly, the second thing I just want to mention, we saw the IPC report talk about the severe malnutrition. If we remember, and we go back to November during the humanitarian pause, the World Food Program told us about the hunger situation in the north. They said 90% of households were doing negative coping mechanisms. They were skipping meals. They were trying to find whatever they could just at that point in November. And then in January, UNICEF told us that 1 in 6 kids in the north were acutely malnourished and needed intervention. And then we heard a couple of weeks ago that number is now 1 in 3. And then we get this IPC report. So I would say that the information that's coming out is telling us whatever we're doing and whatever we're saying, it's not enough, and that should change.
I think the statements of the UN officials are actually quite strong. And the fact that the Secretary General will be visiting Rafah next week is amazing. But we've noticed that in many other crises that we have a lot of rhetoric but no action. And I think all of us understand the reason behind that, that we have 2 or 3 countries that they have the veto power, which means that this system is not working for the current time. And I'm not the expert on UN reforms, but I think at one point there should be some reflection on what would be the better way to end the crises, because the main purpose of the UN, as far as I know, is to make sure that there's peace in the world. And we're seeing crisis after crisis and disaster after disaster, man-made, with inability of the UN to implement its mission. And that has to make us, all of us, reflect on this issue and move towards more UN reforms.
Just a couple more before our doctors move on to the next meeting. Go ahead.
Thank you so much. My name is Alan Bulkati from news agency Ria Novosti. Have you all witnessed injuries sustained from the white phosphorus bombs in Gaza?
I haven't, no. I've heard numerous stories about it, but I haven't seen it myself.
And it's hard when you have burns coming in. It's hard for us to be able to say this is from this or that. What we see are severe burns, and there's a ton of patients in the Gaza Strip with severe burns. So I don't think any of us are weapons experts or familiar with kind of military bombs in that to that degree.
What people described is a lot of burns, that more than the previous wars in Gaza. And I would, I think the local Palestinian physicians are the expert on what kind of weapon that has caused this injury. And I hope that you will have a chance to check with them, because they will tell you what weapon caused this type of injury. But what we were told, that there's a lot of burn, severe burn, that they did not see in previous wars.
I'll add one thing to Hassan Abu Sitta, who you'll be familiar with, who's a close friend of mine in London, who spent the first 42 days in various hospitals. He saw a lot of white phosphorus burns, and I've spoken to him about that, and describes them as very, very distinctive burns, which you can distinguish from this. I saw lots of burns, but just explosive burns. So I've seen photographs he took, and I think there is unequivocal evidence of that usage. I didn't see it myself.
The same toward the beginning of the war. I've seen photographs from surgeons with whom we work that look very much consistent with that, but very difficult to tell without being there. There's a certain smell that it emits, for example, so it's hard for me to say myself.
In the back.
Thank you, Nabil Ansar, Al-Arabi TV station. We heard about some field hospitals deployed in Gaza. Have you worked with them, or have you seen the impact on the health system and the basic needs that people want? And also, how much we can expect from this kind of deployment? You think this could be a good alternative to the health system in Gaza that obviously needs a lot of work to be back in action?
Categorically, no. It is not an alternative. It is not a substitution. There were 35 functional hospitals in Gaza prior to the war. They are well equipped. The healthcare system was not perfect, but robust. The medical staff are some of the most intelligent people I've ever worked with in my life. No, you couldn't put up 1,000 field hospitals that would be able to address the needs in Gaza today. There are hospitals that... I was saying you could put up 1,000 field hospitals, and they wouldn't address a tenth of the needs in Gaza today. The hospitals that exist need to be rendered functional again. The health system needs to be restored. If there's anything to add to Gaza Strip, it would be post-operative beds. Lots and lots and lots of beds, thousands, tens of thousands of beds, just to be able to house all the people with surgical needs and non-surgical needs, because while the hospitals themselves can function, you have to have a place to put patients while they're recovering. And that's where there may be a need for field hospitals in that sense, but absolutely not to replace the health system that existed before the war.
So before the war, there were 6,000 hospital beds in Gaza in the 39 hospitals. Now, according to the last number I've read, there's 295 hospital beds remained. And I'm aware of 4 field hospitals. One, the Emirati field hospital. One is the Jordanian field hospital. One is the IMC and Kuwaiti. So all of these will add probably 300 additional beds. The problem with field hospitals, I visited the Emirati hospital. It's quite impressive, actually. They have the only functioning CT scan, by the way, for 1.5 million people in Rafah. And they have 200 beds, but for some reason they had only 80 patients, although they had more capacity to receive more. And they have quite good surgeons. Actually, before we went to Rafah, we were told that if you are injured, you will be admitted to the best place in Gaza for your treatment, which would be the Emirati field hospital. But it's not enough. Other field hospitals are level 1, which means that they treat patients with dehydration and common conditions, but they're not going to be able to operate complicated surgery or take care of patients in the ICU. So I agree with Amber that there's need to rebuild the other hospitals, make sure that they are equipped with medical equipment that were destroyed, make sure that doctors go back to the hospitals and the community rebuild around the hospitals. That's how can you avoid further morbidity and mortality.
Just one or two more. Go ahead.
Yes, Stefano Alcala with New York. I wonder what the people, these patients, but also the people that just stays around the hospitals, what do they think about, do they believe that Israel will stop if all the hostages are released or the Hamas leave? Do they believe something like that? How do they react? Or they don't believe it at all and they say, no, they will continue and kill us anyway?
That's a good question. What I know, and I think this is a sentiment that we all witness, that people want for the war to stop. And at one point when we were in Rafah, there was this rumor, which we were not aware of, that there is a ceasefire. And then we heard a lot of people chanting in the streets in the area, and we did not know why they are chanting. We looked at the TV, there's nothing there. And then I think Thaer went and asked, and they said, we heard that there's a ceasefire. So people actually believe that at one point there will be ceasefire and that the war will stop. They actually, I found them more hopeful of the war stopping and rebuilding and going back to their places in northern Gaza. Many of them, I asked them, would you go back to northern Gaza? They said yes. And we know that we're going to be living in tents for maybe a few years, but they want to go back to northern Gaza. And I did not, frankly, see the bitterness that I expected to see in the people that I interacted with. People are quite resilient and patient and honorable and dignified, and they are thinking of futures. I just want to give one story about children, because children do not lie. Every child I asked, what would you like to be in the future? They said doctor. They did not say martyr or fighter. They said doctor. Except for one child, actually, and that reflects your question. He said, what future? He was completely traumatized. He was in displacement center. So people are looking for the future. Gaza has one of the highest literacy rate in the region, much better than many of the neighboring countries around and Gaza. And people want to live and want to rebuild and want to stay in their home. And I think the international community and the UN can help them, not only in ceasefire, but also in the day after ceasefire.
And I think it's very dangerous to try to paint an entire population with one brush. I think that we tend to do that when we talk about the global south or when we talk about the Middle East or many regions of the world. People have different opinions and different beliefs, just like they do here or any country where any of us come from. The population, yes, many, the ones that we've worked with are very resilient. And they look to their futures of our staff, because I can't speak for the entire population, but within MSF staff, what I hear about is I'm worried about my children today and my home for tomorrow.
I'll just add very briefly to that. I think we've all clearly spoken to many Gazans, and we've got slightly different experiences. One of the things I've loved about the Gazan people over all those years is as Amber said, their resilience, their hope, their never giving up attitude, and they really are a truly beautiful people. I've spoken to a lot of people out there who actually are losing that now. They are losing hope and wanting to get out. There are clearly people with different views, but it struck me when I was there how many people now are losing that hope, and they talk about how that was a clear aim of the Israeli Defense Force, to destroy everything in Gaza that's worth living for.
Final question.
I don't know if you can estimate this, but how much does the international community need to put in once this war starts to actually relieve in terms of hospital beds, medication, the roads that have been, destroyed? How much can they put in to actually relieve what people are going through and suffering in Gaza? And you mentioned your meeting with members of Congress. I don't know if you can share with us who and what do you hope you can actually change in some of the positions that some of the members of Congress have, given that you are actually bringing eyewitness testimony to them?
How much? As much as the U.S. gives to Israel in military aid every year, as much as European nations purchase from Israel in military supplies every year. Let's exchange that for some humanitarian aid and thinking about a civilian population.
And I think with respect to D.C., our plan is to, again, communicate the urgency. We want to meet with as many different people who will have us. We're still working on that, but our plan is to try to meet with the National Security Council, USAID. We want to get as many people involved in this as possible just to understand, again, what the situation on the ground looks like. And then the other thing I will say with respect to how much is going to take place, I think many people in the NGO community are also talking about what needs to be done. And there is, even with respect to clearing the rubble, it's going to take a massive amount of funding and a massive amount of hands on deck. So I will just put that in place that the day before would not allow us to accurately and efficiently address the catastrophe in Gaza. So if we go back, if the day after looks like the day before, we're not going to be in a better position and people will continue to suffer. There needs to be a different change and a removal of the status quo.
Regarding the senators that we will be meeting with, we met previously in the last few weeks with Senator Durbin, Senator Duckworth, Senator Merkley, Senator Warren, Van Halen, and several others, and they were really interested in what's going on in Gaza and what they can do to improve aid to Gaza. And I think some of them have even shifted their position and called for ceasefire. I think we have scheduled meeting with Senator Bernie Sanders and also the staff of Senator Van Hollen. We're looking to meet with Republican senators because I think that's more important than Democratic senators at this point. And I think the more messages like this we convey to them with stories from the ground, hopefully that will help them shift their current position.
Wonderful. Thanks so much. Thank you, Anka, for hosting. And thank you to our doctors. Thank you. Thank you.
Oh, well.
Do you know Tanya?
Yeah, very well, very
you
well.
mentioned her here, but I thought, oh,
Tanya, I know really well. She's in Al-Aqsa at the moment.
Oh, good.
Yeah, she is.
Because we hadn't had any pediatric programs to send her
I
to.
know.
And
I took her on a, so when she was a medical student, she came out with me to the West Bank.
Oh, that's amazing.
So
she was with us in Lebanon, and so we've been writing.
Yeah, I was thinking about this. I meant to mention.
I gotta find her, and I keep telling her I'll try to find you a position as soon as I have a pediatric unit. So I'm really